Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Muhamad Aly Rifai, internal medicine physician and psychiatrist. Today's Kevin MD article is How Deep Transcranial Magnetic Stimulation is Transforming Mental Health Care. Muhamad, welcome back to the show.
Thank you very much for having me to talk about this timely topic on the treatment of depression and treatment refractory depression.
All right. What's this latest article about?
Sure. So in my article, I talk about patients who suffer from depression. About 25 million Americans suffer from depression. And despite our best pharmaceutical treatments, there is at least 50 to 60% of patients that end up with partial or non-response to antidepressant medications. And specifically, there's about 30 or 40% of patients who have depression will end up with what we call treatment-resistant depression. And this is where patients do not respond to antidepressants, despite multiple trials of different antidepressants, different classes of antidepressants, or multiple antidepressants. And they end up with this state of prolonged sadness. Relentless depression kind of drains somebody's identity. It drains the color out of their life. They end up being disabled, jobless. Their self-worth disintegrates. And this condition, severe treatment-resistant depression, had been without treatment for many years, up until the beginning of the 2000s, where we started trying additional treatment modalities other than pharmaceuticals to see if we can affect the treatment of depression. And in the past, there's been other pharmaceutical treatments, but we wanted to try something different. Now, in early on, electroconvulsive therapy was a treatment where electricity would be passed through the brain to induce a seizure. But that treatment is hospital administered. It requires anesthesia. This newer treatment, transcranial magnetic stimulation, was FDA cleared and approved in 2008. And we found out that if we are able to stimulate the areas of the brain that are involved with depression, that we are able to induce a significant response. So transcranial magnetic stimulation was cleared in 2008. And the first treatment was what we call superficial transcranial magnetic stimulation, where actually a magnetic coil is placed on the left side of the brain, the frontal cortex, where actually it stimulates a magnetic field and causes basically changes in the frontal lobe. And later on in 2013, this newer treatment, which is deep transcranial magnetic stimulation, which is the helmet behind me, which is like a helmet, just like the movies people know, Magneto, the fits on the head and induces a magnetic field around the brain, targeting mostly for depression, the frontal cortex. And that has been very, very helpful in terms of treatment of depression.
Now, when you talk about treatment-resistant depression, so are there any predictors that characterize those who are resistant to traditional antidepressants?
So there are some predictors. Sometimes the severity of depression, so individuals who suffer from severe depression, like high scores initially on their treatment scales. There's also a family history of depression, a family history of bipolar disorder. If individuals also have some genetic polymorphisms that actually predispose them to not being responsive to medications, those are usually predictors that this person is going to have treatment-resistant depression just because of their inability to tolerate the antidepressant medications that we have, or their inability to reach a appropriate and a therapeutic level of these antidepressants, especially with, for example, patients who are ultra-rapid metabolizers. So whatever antidepressant you give them, their system will ultra-rapidly metabolize the antidepressant, and you will not be able to reach a therapeutic level. So those patients, sometimes when we do genomic testing, we're able to predict that they are going to be treatment resistant just by the fact that they cannot reach a therapeutic level of antidepressant medications. A family history of depression, severity of depression, those are all kind of predictors for treatment resistant depression. And so we're hoping that some of the changes are going to be that we're going to be able, if we predict who is going to be treatment resistant, to actually bypass multiple painful long trials of antidepressants and go to additional treatments such as transcranial magnetic stimulation.
And what are some of the efficacy data for those who undergo the transcranial treatment?
Sure, sure. So the efficacy has improved significantly, as well as the utility of the treatment. So when the treatment was approved in 2008, it was the figure-of-8 coil that gets applied on the frontal lobe, on the prefrontal cortex, and basically it induced a magnetic field. The treatment length was 45 minutes, and you had to do it for up to 5 days a week, up to 6 weeks. So that was a very lengthy treatment. You had to come to the office every day, 5 days a week for about 6 to 7 weeks to get some relief. And at that time, the treatment efficacy was around 40 to 50%, even with that. When deep transcranial magnetic stimulation, which is the helmet that's behind me, was approved, actually the response rates was significant. Partially also because the length of the treatment session decreased. It went down from 45 minutes to 20 minutes. And basically, we still did it for 6 weeks. But the rate of response, because we were targeting deep inside the brain with a magnetic field, the treatment actually increased, the treatment responses increased significantly. So it went up to about 65 to 70%. And the rates of continuing to remission 6 months to a year after treatment went up to about 50 to 55%. Then newer treatment modalities were introduced that's called Theta burst, where we actually intensify the magnetic field around the brain to see. So basically, this is analogous to like increasing the dose of a medication. Theta burst was an increased dose of the magnetic field with a readjustment of the strength of the magnetic field. We were able actually to also shorten the treatment session length to about 3 to 5 minutes. So significantly from 45 minutes down to 20 minutes, now to 3 to 5 minutes. And we were also able to, over the last few years, see if we would have the same success by lengthening the treatment duration. So instead of 6 to 8 weeks, we tried to shorten it to about 2 weeks. And most recently, there's a treatment protocol that's actually 1 week of several treatments a day, 5 days a week, and people are achieving remission from depression of about 70 to 75%, which is pretty amazing. Treat your depression in 1 week. We're also looking at protocols where you actually come in and you spend the whole day getting treatments, short treatment, 3 to 5 minutes, with a rest of 25 minutes, and then you repeat the treatment. And we're hoping to see if we can get good response with 1 day of treatments. So we're having the treatment down from 6 to 8 weeks, down to 2 weeks, now down to 1 week, and we're hoping it's 1 day. You come in for treatment, you're depressed, you're hopeless, you feel that the weight of the world is on you with severe depression, you haven't responded to any antidepressants, and then you get a treatment. So now it's 1 week, and we think we're going to be able to do 1 day of treatment to help individuals who have this severe treatment refractory depression.
And what do patients feel when they're undergoing therapy?
Patients feel that, so the treatment, basically the patient is comfortable. It's like the helmet. We put a cap on the head, and the helmet fits snugly on the head. And basically the patient sits like, I don't know if somebody had been under the hair dryer in a hair salon. It's that comfortable. They feel a little bit of tapping on the head, but there's no discomfort, there's no pain, there's no anesthesia, there's no loss of consciousness. The patient is comfortable. I have some patients who listen to music. I have some patients who read books while they're getting their treatment. And then the patient you remove the helmet and the patient goes home, they drive home. So there's no after effect. Even the prolonged treatment where you do several treatments in a day, the patient is comfortable. The effect is localized only on the brain. And there's very little adverse effects, maybe a little bit of headaches, but that's it. That's the worst side effect that patient experience. 1 in 100,000, if a person has a history of seizures, they may experience seizures. And I've been doing this treatment, administering this treatment to my patients for 12 years, and I haven't had 1 case of seizures. So it's pretty safe treatment, pretty effective. Basically, we added on to medications, but it could be a replacement for medications in the future. Now, this treatment also is expanding, so it's not just treatment-resistant depression. There is anxious depression, so people who have predominant anxiety with their depression. It's also indicated for late-life depression, so individuals, older individuals above the age of 65, whose depression is more like not responsive to treatment, that could be administered to them. There's also a different type of helmet that it treats individuals who have obsessive-compulsive disorder. So the coil targets different areas of the brain, mostly like most in the parietal and temporal lobes. So the coils are in the back of the head. And there is a different helmet that is being studied for nicotine use disorder. And we're hoping that it's also going to be very, very successful for opioid use disorder. So we're expanding that treatment, the magnetic treatments for depression, non-medication treatment. And that goes along with basically the kind of the movement about, we've talked about that in previous talks about how America is over-medicated and there's a lot of people on medications, and how this treatment modality could be able to replace medications in a natural way, which is a magnetic field.
Any potential complications or side effects?
The side effects, just the discomfort in the forehead, and there's no memory loss, there's no confusion, there's no anesthesia, the person is comfortable, they're able to drive home after they're done. 1 in 100,000, maybe a risk of seizures if somebody has history of seizures, but I haven't had any cases like that. But people are very, very happy with treatment, and they're amazed. They feel that they get their life back. They feel that they can see colors again. They're more functional. They're back to doing things that they missed before. And they're able to be on less medications potentially, and potentially off medications if the treatment continues to be successful. And we've had good success with cases actually continuing to show improvement after 1 year. The people continue 50% to 60% continue to be in remission. If somebody has a relapse of their depression, we're able to retreat them for another session of TMS, exactly like antidepressants, but this is simple, no medications, and the patients tolerate it pretty well and can take them short time away from their work, and they're able to return back to work and to their family with remission of their depression.
Now, is TMS, transcranial magnetic stimulation, is it covered by insurance?
It is covered by by insurance. So let's start with the largest insurer, Center for Medicare Services. Medicare covers transcranial magnetic stimulation since 2009. They've been a strong advocate for it because a lot of individuals who are on Medicare experience depression and anxiety, and they have adjusted their coverage criteria that they allow you only to start utilizing transcranial magnetic stimulation after only 2 trials of antidepressants. So you don't have to try 10 different medications to get to TMS. You try one antidepressant and that's not successful, you switch to an antidepressant from a different class, and if those are not successful, the Medicare will pay for transcranial magnetic stimulation. And similarly, the private insurance have realized that this would be a good alternative to hospitalization. So if somebody has depression and their depression is severe, you could administer transcranial magnetic stimulation and realize significant cost savings as opposed to a person being hospitalized in an inpatient psychiatry unit. This is going to be able to avoid hospitalization, keep a person out in the community, return them to work as soon as possible, return them to family, and return them as functional member of society.
So how about in the primary care setting? If I'm seeing a patient who have symptoms of depression, or if I'm treating them for depression, what are some typical scenarios where in the back of my mind, I may consider transmagnetic stimulation as the next step for this patient? What would those patients typically look like?
I would think about it early because you know a patient who suffers with depression, when they present to the primary care doctor, it's usually the symptoms have been going on for a little bit. They don't present like the first sign of trouble. Usually the symptoms would be going on for several months, and by the time you give them an antidepressant, and you bring them back in 4 weeks, that's like 4 to 6 months have already passed on somebody who's already in depression. They either have side effects to the first dose of antidepressant that you give them, or they want to switch to a different agent, and then you switch them to a different agent, and then we're already 6 months into an episode of depression. So I would start thinking about referral to a psychiatrist for transcranial magnetic stimulation. These machines are available in most cities now. Psychiatrists are administering those treatments. There's availability, different brands of machines, but the treatment is available. It's approved by insurance. It's much better for the patient to receive transcranial magnetic stimulation and return back to life as soon as possible rather than wait with an antidepressant that is not working. So I encourage my colleagues in primary care to think about transcranial magnetic stimulation sooner than what they do with people doing on multiple episodes of antidepressant treatment and suffering while not receiving adequate treatment and adequate response to antidepressants.
We're talking to Muhamad Aly Rifai, internal medicine physician and psychiatrist. Today's Kevin MD article is How Deep Transcranial Magnetic Stimulation is Transforming Mental Health Care. Muhammad, let's end with some take-home messages that you want to leave with the Kevin MD audience.
Treatment for depression and treatment refractory depression is available. Transcranial magnetic stimulation and deep transcranial magnetic stimulation is a valid option that should be considered early through our colleagues in primary care, not wait trying multiple courses of antidepressant medications. Refer these patients early to a psychiatrist that administer transcranial magnetic stimulation and deep transcranial magnetic stimulation for these patients to receive relief from their symptoms of depression and return back to their normal life.
Muhammad, thank you so much for sharing your perspective and insight, and thanks again for coming back on the show.
Thank you for having me.